action. Okay, so what we're going to do is we're going to show you an example of the neurologic exam as per the PCL. So I'm HO2 Marker, this is HO2 Cruz, and we're just going to walk through it pretty bare bones, cut and dry. All right. So to start with, as with all PCLs, you're going to come in and you're going to do vital signs and a couple questions for the patient. So you obviously want to come in and introduce yourself. Hey, how you doing? I'm HO2 Marker. I'm going to be your IDC student today. I'm going to be doing a neurological exam on you. So vital signs and then TEAM, so VTEAM, if you can remember that acronym. Vital signs includes your blood pressure, your pulse, your respirations, your SpO2, and your temp. Okay. You can actually collect that during the PCL, but for right now, for instructional purposes, we're just going to say that I took those. Now, the TEAM is going to be ask the patient if they have use of tobacco, alcohol, medications. Are you on any medications right now? And then any allergies. If they say yes to those, there's some follow-on questions like, what's your reaction to certain allergies, medications, dosage, last oral intake, all that kind of stuff, okay? So just make sure you know all that. Now, when you actually get into the PCL, the very first thing the very first part of the PCL is the cranial nerve exam. So it's going to be cranial nerves 1 through 12. So cranial nerve 1 is your olfactory. So what I'm going to do is I'm going to have the patient close his eyes. I'm going to have the patient close his eyes, and I'm going to have some sort of substance that has a pretty aromatic type properties to it, like cinnamon or alcohol. And I'm going to say, okay, can you just close one of your nostrils for me? I'm going to hold something under your nose and you just tell me what it smells like, okay? Good, okay. And then another way to do this too is have them close the nose that they just had or they just smelled with, so go ahead and close the same nostril or the other nostril. Okay? And then say, okay, what do you smell? There. And that way you can actually verify that the patient is not, faking their response. So the second cranial nerve is going to be your optic, and this is just gross ability to read something, okay? Gross optics or gross optic nerve. Okay, so I'm just going to have something that's relatively small, but I mean you could even use a name tape or anything that you have maybe on your uniform or a shirt. But I'm just going to have the patient read. Okay, go ahead. Can you read that for me? What does it say right here? Allegiance. What does that say? Okay, great. So that way you know that the patient's optic nerve is intact. Now when you test 3, 4, and 6, it's going to be your ocular motor, your abducens, and your trochlear. So it's 3 is ocular motor, 4 is trochlear, and then 6 is abducens. Okay. So that's all going to be utilizing field of gaze, a couple tests that you're going to do with that. So first thing I'm going to do is I'm going to say, okay, just go ahead and follow my finger. So what you're going to do is you're going to do the 6 cardinal fields. I'm going to come out to the lateral aspects of the field of gaze, and I'm looking for nystagmus, which is the bouncing of the eyes. Go ahead and just give me an example of what it would look like, kind of back. Yeah, pretty much. A little bit of a bouncing with the eyes at the lateral aspects, okay? And then you're going to want to go up, down, diagonal, 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 and then convergence, making sure that the eyes come together. And then you're also going to want to do a test that involves the periphery, okay? So you're going to go ahead and get about maybe 1 foot to 2 feet away from your patient, and then you're going to take your hands out to the sides. So about your periphery and their periphery, and you're just going to say, go ahead and look me in the eye, and I'm going to say, okay, I'm going to wiggle a set of my fingers, and you just tell me which set is wiggling, my left or my right, or your left or right, just one thing, okay? So, good. 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 All right, great. So we tested 3, 4, and 6. Now we're going to do cranial nerve number 5, which is going to be your trigeminal. So trigeminal is broken up into 3 areas, 1, 2, and 3. Oh, just to mention too, 3, 4, and 6, you can do the Perla exam too. So you're checking for pupils equal, reactive, round to light. Okay, but regardless, trigeminal. So I'm going to just say, go ahead and tell me if you have any changes in sensation. I'm just going to lightly touch you on both sides of your face. Okay, just tell me if it feels the same. So light touch up here. Okay, light touch here. Okay, and light touch here. Okay, 3 roots of the trigeminal nerve, and then you can also go ahead and say, I want you to clench your jaw, and you're feeling for those muscles of mastication here, and then go ahead and do it again, and the muscles of mastication in the temporal area. Okay? So the next cranial nerve that we're going to test is number 7. That's your facial. So while I'm doing my my trigeminal, after I'm done with that, I can go ahead and stay here and say, okay, I just want you to make some faces, and you're basically utilizing all of the muscles of the face to make sure that you have symmetry, you don't have facial droop, everything's equal. So you're just going to make like 6 different faces. So can you go ahead and smile for me? Real big. Go ahead and frown. Furrow your brow. So you're looking for it to be equal. Go ahead and look surprised. Okay, so everything looks equal, everything looks symmetrical, nothing, you don't have any facial droop, you don't have any asymmetry or anything like that. Okay, so after that is going to be cranial nerve number 8, which is vestibular cochlear or auditory, depending on what you want to call it. So what you're going to do is you're going to take your, kind of like how you did the peripheral gaze, what you're going to do is behind the patient's ears like this, and you just say, go ahead and look at me, and I'm going to wiggle, or I'm going to make this noise on one side or the other, and you just tell me which side it is, okay? Okay. Good. And it's just gross auditory, okay? After that, you're going to go on to the glossopharyngeal, the vagus, and hypoglossal all at the same time, okay? So easiest thing to do with that is just get yourself a tongue depressor,